You're watching C-TOAM TV. Knowledge is power.
Claire was wondering, she said her doctor told her that genetic testing is not going to show the reasons for her cancer, so there's no point in getting it.
Yeah, and I think the doctor is correct there in their terminology. Once again, Claire, you need to ask what the doctor means by that, and you need to ask with clarity and bring up the list that we provided you with earlier. So what the doctor is saying is the reasons for your cancer. In other words, what caused those genetic mutations, they don't know. Was it a chemical exposure? Was it, what was it? Was it, a genetic inherited circumstance? Was it exposure to chemicals? Was it exposure to radiation? What happened?
Mm-hmm.
Of course, it's not going to show that. But what it will show is the actual genetic features that are causing your cancer. And so there's a bit of trickery there. The reasons refers to, what has actually caused those mutations, whereas the causes refers to what is actually causing and driving that cancer.
Mm-hmm. So, for example, if I worked, say, as
a trick answer,
if I worked as a greenskeeper for 30 years, exposed to all sorts of pesticides and things like that, and then I've come down with some sort of cancer, genetic testing isn't going to show that was absolutely 100% because of your work as a greenskeeper.
Exactly.
But you will, through genetic testing, be able to see some mutations in your DNA, those molecular features, that there might be some data that shows, oh, this actually often happens for people who are frequently exposed to this pesticide.
Yes,
so your doctor would be reluctant to say, absolutely, it was your job that did that. But that, as Alex is saying, is kind of not the point. The point is, once you identify those molecular features, you now know what is driving your cancer. And there are many hundreds, Alex says thousands, but he knows best, of targeted therapies and treatment options once you know what your features are.
Thank you for watching C-TOAM TV. Subscribe below and stay informed.